Okay,
There we
I
go.
think it started recording. So
Yeah.
I'm going to provide a little bit like information about your background, Dr. Lomas, and after that, just like if I'm missing anything, just provide more information about us. And then after that, like we will be hearing your behavioral research and personal experiences on counseling African Americans. So Dr. Angelia Lomax earned her bachelor degree in psychology from Middle Tennessee State University, her master's degree in mental health counseling from Long Island University, and her PhD from Liberty University in 2021. Her doctoral dissertation entitled Black Affect, Black Students' Experiences in KCRIP Master's programs at HBCUs. She is the founder of Nurturing Black Minds, which aims to provide the necessary tools, information, and resources to support Black mental health and achieve progression through empowerment. She's also right now teaching clinical mental health courses at the Liberty University as an adjunct faculty. Thank you so much for being here, Dr. Lomax.
Yes, of course. Thank you all for having me. Oh, thank y'all. So yes, everything that you read is very much on par with the work that I've done, or some of the work that I've done, right? So my dissertation, as you mentioned, was focused on Black student experiences in their master's counseling courses. And what I found basically is that there are a lot of similarities between what Black counseling students need and what our African-American clients need. So there's a lot of parallel processes that occur. So I don't know if any of you are planning to go on to be counselor educators, but that's definitely something that you'll want to keep in mind, that your students have a lot of the same needs as your clients. It just will, of course, manifest in different ways, right? So the presentation that I've prepared today is about more focused on the client side, right? So less about what the students need and more about what clients need from you all as clinicians. Is that more consistent with what you wanted, Professor?
Yes, like anything, like, just like literally any, because they already have they have read the chapters. So like anything that you share would be a really additional information and very valuable for us.
Gotcha. Okay. Are you, could you allow me to share my screen, please? Or I can do the presentation without it. Either way is fine.
Okay, so I think I did that, but like, let me try again.
Okay.
Yes. You should be able to right now, actually.
Okay. Perfect. I can. Thank you. I hope that I'll still be able to see you all when I am sharing. And yes, I can. So that's great. So yeah, we'll jump right in. And if at any point you all have questions, just stop me and let me know. I don't want to just ramble on if you all still have questions about what I'm covering, okay? Okay, great. So and I know that you all have read the chapter already, and that's wonderful. So these are just some of my thoughts based on my professional experience and research. So when you are counseling African-American clients, it's definitely important to consider how people see themselves and how they see the world, which is largely based on their culture, right? And so that's what a lot of this presentation is about culture and understanding your client's culture. And so we know that culture is basically a set of collective norms, right? And that culture extends beyond just race and ethnicity, but it can include all of these other things, including your gender, your birth order, your age, language, all of these different microcultures have their own norms that you want to consider when working with any client, right? And specifically African American clients, because that is going to inform how they think, how they set goals, how they experience the world, how they think the world experiences them. And so you want to take all of these things into consideration. And so what we're shooting for, what we're going for, the goal is cultural competence, right? And what's included in cultural competence? That's being curious, that's cultural humility, cultural sensitivity, cultural awareness, and then your awareness of your own biases, right? So cultural humility reminds us that although we have awareness of different cultures, general information about different cultures, we know that each individual client is the expert on their experiences. So as much as we can read about different cultures, we still want to go into the session knowing that the client is the expert on those things and that they may look different for that client. Because like we saw in the previous slide, there's all these other cultures to which they identify too. They're not just African American, they are a Black man. They may be a Black man, a Black person who identifies as non-binary, right? So that will impact their experiences too. So we want to take all of that into consideration. That's part of cultural humility, knowing that, hey, I know some general things, but you are the expert at your life. And so I want to hear from you how you experience different things and how you think and how you feel. And then cultural sensitivity is the action of that, right? So that's knowing and having awareness of different cultural norms, having awareness of proper terms to use, proper language to use or to not use, right? And being sensitive to that. And then those biases we'll talk about a little bit later, but knowing what biases you have about a particular person who identifies with different cultures, right? Knowing those biases, we're human, so we're gonna have some biases. That erasing them is not the goal, right? The awareness of that is what will help us to be able to bracket those things if we need to, and to be able to show up for our client. Any question about any of these things so far? Okay. So cultural competence is even outlined and defined for us in the Code of Ethics as counselors, cultural and diversity awareness and knowledge about self and others, and how this awareness and knowledge are applied effectively in practice with clients and client groups. So the Code of Ethics is filled with different things about being multiculturally competent, and what that may look like in different contexts, right? As the Code of Ethics is divided into different topics, there's something about multiculturalism in most of those different areas of the Code of Ethics. So we're going to go into the person of the counselor, and I guess this will be a little interactive part for us. I know that you can see that I have the self-awareness and things there. What do you think, or how do you all think that cultural competence shows up as the person of the counselor? Or how do you think that looks in self-awareness? Anybody? How is self-awareness connected to cultural competence?
Oh, self-awareness to me means like you have to know yourself first. Like because we all have like something that's wrong about us. You have biases, as I said earlier, and then if you don't know about all those things, like we're not going to be honest on ourselves. And I think that's the beginning of like a failure. It's about being a counselor.
Yes, yes, absolutely. That's a great answer. Um, what about not doing harm to our clients? How does that connect to the person of the counselor?
I mean, I feel like it's hard to even describe it because it seems like self-explanatory. You know what I mean?
Yep.
Like, of course, you want to help your client, not harm them in any way. So, you know, and I guess being aware of how something that might be unintentional to you from your perspective might be very harmful to someone else, and like understanding the potential for that and making sure you're, I guess, like sensitive.
Right. Absolutely. Absolutely. And that goes along with the last one, right? Sensitivity, because what it sounds like you're referring to is our microaggressions, right? So we can say things that we don't necessarily know to be harmful or that we don't mean to be harmful, but they are in fact. So doing that, going the extra mile to be aware of culturally appropriate wording, right? And behaviors and interactions will minimize the probability of microaggressions. Absolutely. And I think the first person who responded kind of touched on worldview with being aware of your biases and how you see things. So that's awesome. And we already talked a little bit about cultural humility, right? Like recognizing that the client is the expert and balancing that awareness and curiosity. How would you all describe cultural humility if you had to put it in your own words?
To me, I guess cultural humility would be understanding that your worldview is not the same as the person sitting across from you, and allowing them the space to inform you how they view the world and how they experience things.
Absolutely. That's a great answer. It's a great answer. And we know that this is an ongoing process, right? Cultural competence in general is an ongoing process as things are changing and we are learning more. We know that this is an ongoing process. So there's no like, I've arrived, thing with cultural competence. We're always learning, always updating our information. Have you all talked about or heard about culture brokers? So sometime, and it's not as common, but if you're working maybe at an agency or a practice, right, there may be someone who you all may consider a culture broker. That just means that they have more knowledge, experience, expertise, and things like that with the specific culture. So you can, if you're working with a client, right, and you don't necessarily know a whole lot about one part of their culture or one of the cultures that they identify with, then your agency or someone in your network may serve as a culture broker, because the code of ethics tells us that we only work within our competence, right? And so instead of referring a client, say you've been working with a client for, y'all have had like 4 or 5 sessions, and then they tell you something comes up, there's a culture that you didn't know about that they identify with. Say it's a Black man, right? And he is same gender loving and he is Christian, and you know all of these things and you're fine with that and you've worked with that. And then he shares, I don't know why this would never come up before, but he shares that he's a veteran, right? And we know that they have unique needs sometimes. So instead of saying, oh, the code of ethics says that I can't work beyond my competence and I don't know anything about working with veterans, so I need to refer my client out who I've built rapport with, and they feel comfortable with me, you would instead go to a culture broker, someone who has worked with veterans, someone who you can consult with, so that you can continue to work with your client, even though there's a piece of their culture or one of their cultural identities that you don't necessarily know about. So you definitely want to keep that in mind, because when I'm teaching, I've had a lot of students and if I give an example, they'll say, oh, I'll refer them out to somebody else who has more experience, right? Which is great in theory, but we want to be careful about not doing harm to our clients, because we know that after clients have built rapport with you and gotten comfortable, it may be hard for them to start all the way over with the new therapist, with the new counselor. So we want to make sure that we keep the client in mind at all times. Does that make sense? Perfect. And so how do we develop cultural competence, right? So many different ways, through training, education, and experience. So continuing education classes, you'll start getting emails about CEUs, right? So there's different trainings that you can attend, or workshops that you can attend, where they teach you different best practices in the field. You can go to conference sessions that are specifically based on multiculturalism. Check out webinars, join professional organizations. These are things that you have to do on your own as a clinician to make sure that you're developing and always working on your cultural competence. Also education, so things like this, right? Classes like multicultural counseling, making sure that you're tuned in and that you are paying close attention to that information and taking notes if you need to, right? Doing your own research. Classes cannot teach you everything, right? You have to take the responsibility of developing yourself as a clinician, completing literature reviews, looking through articles and presentations, podcasts, right? So that especially if you know that there's a certain demographic that you'll be working with. So if you know that you'll be working in an area that's predominantly African American, you may want to do some extensive research, right? Just so that when you do have those clients, you're able to bring some awareness, still keeping that cultural humility, but bringing that awareness of the general information about that population with you. That'll help them to feel more comfortable, because although you may not, I can't really see everybody, but although you may not look like them, right? Having some awareness will let them know that you've invested in wanting to learn and understand their experiences, which is super important. And then experience. Taking advantage of opportunities that allow you to work with different cultures, or African Americans, since that's what this presentation is about. Taking on those opportunities so that you gain that experience, and working in environments where you're exposed to that. And then also working with your supervisor, your clinical supervisor, if you have any questions, or if you're having trouble with the client, going to them so that they can help steer you in the right direction. Any questions so far? Okay. A few things to keep into consideration, to take into consideration and keep in mind, that although we're talking about one group, African American people are not a monolith, meaning we are not all the same, right? So as I've mentioned before, there's an intersectionality that happens among microcultures. So all of those, so we have the big, like the macro, like the big race, religion, ethnicity, those types of things. But then you have those microcultures of, sexual orientation, or birth order, or different types of religion. Well, yes, different types of spirituality, different types of career paths. All these things are microcultures. So you may have a Black woman who is Christian, or who is more spiritual than religion, who's a college student or a college graduate. That may look very different from a Black woman who is spiritual, who has a 12th grade education, right? So we want to take into consideration all of these microcultures, because Black people and African American people have shared experiences, but even when there are those shared experiences, there are still individual perceptions of that experience, right? The same way all of you all are experiencing this presentation, you still have your very idiosyncratic perceptions of what's happening and what you're taking away and what you're hearing. Same thing, shared experiences, but individual perceptions. So you don't want to like treat all of your African American clients like they're the same, or like all African American people are the same, because everybody is their own individual person that comes with their own experiences, thoughts, perceptions, beliefs, values, and all of those things. So that's why that cultural humility is important, because you have an awareness of like generalized information. But when you're working with African American clients, you want to be sure to individualize each experience. Any questions before we get into like the clinical approach and what happens in the therapeutic process? Okay. So there are a few very specific things out there. So there's a theory, multicultural counseling theory, right? Which talks about being intentional about taking into consideration your client's cultural experiences when providing therapeutic services. I love multicultural counseling theory, and regardless of what your therapeutic approach is or theoretic orientation, you should always consider one's culture, regardless of if you're using psychoanalytic, CBT, Gestalt, anything that you're doing, you're going to want to think about their culture. So I know that people are like, oh, I'm a CBT counselor. Oh, I have this approach. You're eclectic, I would say, because you also want to use multicultural counseling theory in combination with whatever other approach that you take, right? And if you need some, but multicultural counseling and the next framework that I'm going to mention is super beneficial if you need some very concrete interventions and actions and frameworks from which to work with your clients. So multicultural and social justice counseling competencies is one framework that you can use that has some very clear and concrete interventions and techniques that you can use in order to be intentional about considering one's culture if you're not able to kind of do it abstractly. One thing that will help when working with African American clients is being aware of the historical and current collective experiences and traumas that we experience, right? So understanding different historical events will give you a better idea or understanding of what the client may be experiencing. So their emotional reaction or their current experiences may be a reaction to historical traumas. Does that make sense? So you definitely want to be aware of those things as much as possible. And we've mentioned this and it's super important. So it's here again, being aware of your biases, because when you're not aware, that's when those microaggressions are more likely to happen. And so it's work, right? Just like the client is doing their work as a clinician, you have to work to uncover your blind spots. They're blind spots for a reason. You don't know that they're there. So you want to make sure that you're doing your work, whether it's with your therapist or with your supervisor, to see if you have or see what your blind spots are related to African American clients, okay? And then all of this is important, right? But broaching issues and topics is your responsibility as the clinician. This and the next part is even mentioned in the code of ethics. You are to acknowledge differences that might impact the therapeutic process, whether they are overt differences like, hey, I am a white woman and you are a Black woman. Like, let's talk about how that can impact our therapeutic alliance and our therapeutic process. So though that's an overt example, but even if there is a covert, something that may impact the therapeutic process, you want to be the one to broach that topic as the therapist, because it is assumed that you would have the skill, right, to do that in the way that keeps the client safe and helps them to feel comfortable in that space, even though there are differences. Does that make sense? Great, great. And then that also, in doing that, it invites the client to correct you, and you want to be very explicit about stating, hey, if I misunderstand you, or if I misstate something that you've told me, or if there's any miscommunication, please let me know, because this is your experience and I want to make sure that I'm fully understanding you and that you are being heard. So you want to invite them to correct you, because the last thing we want is for a client, for us to misunderstand the client, but they don't feel like it's okay to correct. And then we have this whole conceptualization of the client that's incorrect because they didn't feel safe enough to say, hey, that's not what I meant, right? So invite the client to correct you if there's any misunderstanding. Another thing you can do as a clinician working with African American clients is to explore the contributions of Black theorists, clinicians, and authors. Again, these are not things that are always taught in your theories class, but there are several Black theorists. There are several theories, right, that are based on African culture that have been normed on Black people. So you want to use different interventions that have been proven or shown to be effective with your client population. Okay. And so there are culturally adapted treatments and interventions that are out there. Again, not things that are necessarily taught all the time in our assessments courses or appraisal courses. But if that's your population and you have a client who is an African American client, you want to find those things, those measures and scales, assessments, interventions, techniques that have been normed on Black people, so that you know that there's a higher possibility that it'll be effective. Or if you're ambitious, right, you can be the person to culturally adapt a treatment or intervention. It's a process, yes, but if that's something that you're passionate about, you can do it. And ultimately, you want to create a safe space, right? Create a space for your clients to feel safe sharing, to feel safe correcting you. And then the last one, research, super important. I cannot state this enough. Everything that you need to know is not going to be taught in your courses. You have to take the initiative to go above and beyond for your clients so that you can show up as your best self for them and be able to give them what it is they need. So definitely want to go out and do some research so that what you're providing is effective treatment. Okay. And so I created just an example of one of the approaches or one orientation that their research has shown is extremely effective with African American clients. The humanistic therapies. So Gestalt, person or client center, whichever you want to call it, existential and narrative. This is not to say that other approaches or other therapies aren't effective. This is just the one that I pulled out because I think that this is one of the best types of therapies to use with your African American clients. So true self and self-acceptance. So in humanistic therapies, that is where a lot of the energy is put towards, is identifying and revealing your client's true self, and then helping them to use unconditional positive regard to accept themselves, radical acceptance of themselves, looking at their unique worldview. Because again, like I mentioned before, their worldview is connected to how they view the world, right? How they think, their actions, how they set goals. All of those things are connected to their worldview, their unique worldview, their individual worldview. And so humanistic allows you to focus and hone in on that. And it focuses on the whole person, which is why it's really good for African American clients, because there are so many different aspects of them, so much combination, because they are a part of the diaspora. They have elements of themselves that are African based, right? And then they have elements that are very much Americanized or Western. So they have this very complex identity. And by focusing on the whole person, you're able to take into account all of those things to help them build their personal story and to give a more effective treatment. And so when doing that, you're listening, you're actively listening and making sure you reflect back so you can verify. That's part of what I was mentioning before about allowing and inviting the client to correct you. So you want to reflect what you're hearing and ask follow-up questions to make sure that you're fully understanding, right? And very different from like psychodynamic, right? You want to focus on the here and now. You want to focus on what's happening currently. We know that the past impacts people, right? Impacts our thoughts and things like that. But we want to focus on what's going now. How do you think right now? Not so much focused on the why or what in your childhood led to you being this way. How do you think right now, and how can we use that to help you make meaning of who you are? Right? And so some specific techniques may be role playing. So I'll be this person and you be you, and we can show how things come up. Or you may use exaggerated behavior to show them, like flood them with those emotions so that they feel exactly if it's anxiety, right? You want to flood them with anxiety so that you can recreate a situation where they are experiencing a certain emotion so that you can work through it in real time. So I really like the humanistic approach to working with African Americans for these reasons. Because again, their identities are very complex and you want to address each part and help them make meaning of that so that you can build that agency and autonomy and also create solutions for them, right? Any questions about using humanistic therapies? Okay. And so this part is about like kind of switching gears a little bit, because when you're in an agency, right, working with African American clients is not only about the therapeutic room, like your one-to-one interactions. It's about what they see when they look on your website, what your communications, your marketing material says. Is there representation there? All of these things are important. So the inclusivity piece is also going to help with the therapeutic process. It's going to help with the therapeutic alliance, because most times they may see these things before they see you, right? And so you want to make sure that they are already feeling welcome and safe before they even get into the room with you. So if you have, and I know this is not always the case, but if you do have if you have the space to give any insight to the organization that you're working with, you want to advocate for your clients to be represented and included in your communications, and again, in your visual representations, and all of those types of things. Inclusion is an act of intentionality. It's not something that's just going to happen. It's not just a thought. It's intentional, right? And as counselors, this is a social justice calling to social justice work that we're doing. And so part of that is advocating for your clients, and you want them to feel safe, but you also want them to be represented. You want them to be included, right? Any questions? is there anything that you all want me to go back, any slides you want me to go back to, anything you need me to clarify further?
I think like for the visual representation, that is something that we talk over here in the class as well. Just like having things in your office or like in your agency that is representing different cultures, it is extremely important, and I like the quote that I don't know whether you took from your dissertation or like that the inclusion is act of intentionality. It is something that actually kind of related to my dissertation too, just like intentionality is something very important when you provide mentoring to international students as well. So I think everything should be like that intentionality is part of social justice, just you try to take away the systemic barriers for your clients. So, and I really like that.
Thank you. Thank you.
One question. I'm just kind of curious, when you said that to explore more of the contributions of Black theorists, are there any names that come to mind for you that, to like kind of jump off from?
Yeah. Dr. King Davis, Dr. Linda James Myers, Rob, there's a I'm blanking on his name. I think it's James something, but
James Moore, the one that at Ohio State University.
No, he was the one that I'm thinking of. He worked with Ellis on REBT.
Oh.
He contributed a lot to that. There's actually a presentation I can share with you, Professor, that has a lot of Black theorists and contributors on it. There was also some theorists who contributed to like the Brown versus Board of Education decision, right? So even if you don't want to limit it to like Black theorists, there are also like Latinx theorists, right? Jamaican and Haitian theorists, whose names I'm not, I don't want to mispronounce. But again, I can send that over so that you can have a starting point. Any other questions?
I have a question. Do you feel that the current criteria for diversity, like training for master's programs is enough, or what changes would you like to see made?
I don't think it's enough. I would definitely like to see electives that focus on specific cultures. So one class about African-American clients, there's no way for me to give you all the things that you need, right, in one class. So I think that electives for very specific cultures is a change that I would like to see. Even if it's a religion class and then you talk about a few different religions, right? And then having a module on intersectionality in each of those courses, right? I think that the discipline is doing the best that we can with trying to prepare students, because also we can't prepare you for everything. And I definitely think there's space for improvement. That's a good question. Are any of you all planning to be counselor educators?
Yeah, we have a few students who are interested in the PhD programs.
Awesome, awesome. Well, we are doing research so that we can try to make some changes. So hopefully in a, it takes a while, but hopefully in a few years, we'll see some changes being made to increase inclusivity. Yeah.
Dr. Lomax, I have a question. I know that, just not only that you have done research on the counseling needs of African Americans, but also you have some clinical experiences working with them. Like, I'm just curious about like anything interesting, anything like unique, anything that, just like something that you learned not from the books, from your experiences about like counseling African Americans, like anything like that you would like to share with us that would be really appreciated.
Sure. I think one thing is the impact of collective grief and collective trauma can lead to clients feeling anxiety. So what may, with typical like information gathering that we learn in our master's program, it may sound like irrational thoughts and paranoia or delusions. It's the result of collective trauma, and it's very rational because these things happen. But if you ask the typical questions, well, has this ever happened to you, or have you had, the answers will be no. So it may sound irrational, but that's because it's happened to somebody that looks like them and that they identify with. So keeping in mind collective grief and trauma, I think is super important. Also, I'm not sure if you have any students of color in the room, but over identifying with clients. So being aware of clients seeing you and being comfortable, and then kind of not explaining. What I found is that sometimes clients don't fully explain what they're experiencing to clinicians who look like them because they assume they already understand. And on the other side of that, they may not feel comfortable sharing with clinicians who don't look like them because they fear that you won't understand. So soft probing and being very intentional about your language and how you gather information, and invite your client to share, is super important. So that has a lot to do with the therapeutic alliance, right? And building the rapport. The more you get to know your client, the more you figure out how you can pull more information out. Right. So if you know that you and your client is more confrontational, or that approach works, it may be like, hey, I can't help you if you don't tell me more about what you're feeling. But for another client, that won't work, right? So with another client, it may be, hey, tell me more about what exactly you felt in that moment. What did that look like? Where did you feel that in your body? So asking questions based on how your client presents, so that based on how you know that they'll respond, is important. And then not overly identifying, not too much confidence as the clinician, right? So because if you say, oh yeah, I understand that, they start to feel like, oh, they think they know everything, or they start to withdraw because they feel like they're not being heard. So the language, I think, is extremely, extremely important. And I didn't learn that in class, because I've had some experiences where even there's the other way around. I may be counseling a millennial Black woman, and I may over-identify, and I have to reel myself back in, right? Because we're not perfect as clinicians, and so I have to tell myself, okay, pull it back in, make sure we're still using clinical judgment, and we're not over-identifying like she's a friend, right? So we have to, again, recognize those biases and be self-aware so that we can make the changes to be most effective. I hope that all made sense.
Any other questions for Dr. Lomax? This is a great opportunity to ask and Clark.
Is it okay if I stop sharing?
Yeah, please.
Okay,
I have a question.
yes.
It's about using the usefulness of gesture therapy in counseling like the minorities like Black people. And then I know that it's like it's gesture that uses like things like you can talk about yourself, your worldview without the fear of being judged. Like because gesture therapy is very sensitive in that case. But it also use like confrontation and then they are more focused on the here and now, on the present. And if you know well about there are some communities they live in the past at the same time they live in the future because there's some people like I have some cousins they are Muslim so they can fight and die today because they're going to heaven after that. So how you do that like with get therapy like dealing with those kind of issues because they're gonna feel maybe so limited like in the present like when you use get therapy with those kind of communities.
So what I heard most of it, but some of it was a little bit muffled. What was the question? You said that how do I help them stay in the present?
Yeah, I remember a lot. Sorry about that. So the thing is like gospel therapy is more focused in the present moment for the on the here and now. So, but there are some people they yes live in the present, but they live in the past and in the future at the same time. So that like people who believe in heaven, you know. So you know what, the here now is okay, but you know they don't have the fear of losing the here and now because they know once they die they're going to jump over to heaven. So how are you going to deal with those people that are still living in the past? Because as you said earlier about like quality trauma, you know, there's some people who are still stuck in the past because of slavery, things like that. At the same time, there are people who are believers, they're looking forward like in the future by using like get out therapy. How could you avoid that? I know it's going to be like walking on, I mean, like you got to treat very carefully, you got to be cautious by using confrontation or things like that.
Mm-hmm.
And that's the only thing I want to raise. How are you going to use get out therapy with those kind of community in a way that you're going to avoid like hurting their feelings because they stuck in the past and they ready to jump in the future.
Okay, gotcha. So how do you help people stay in the present when they're
yeah.
How do you use just start when helping them to stay in the here and now? No, that's a great question. I think validating that that's important, like we recognize that the past is important, and then asking them how does that impact where you are now. So getting them there, right? We don't want to dismiss or disregard their beliefs. So validating, I hear that that's important to you. I hear that you feel that that's had a big impact on where you are now. What impact has it had? And so they may say, maybe there's like a distrust for people who do not identify as people of color. So you have a distrust for those types of people. What does that look like now? How does that impact you right now? That makes you anxious. Okay, what does that anxiety look like? Right? So right now you have anxiety and you have distrust. Okay, let's stick with that. What does that look like? How does that manifest? What types of situations is that impacting? Because those things are important. We just don't want to focus on them. So you could do something like a role play. How would you interact with a person of European descent? If we were in this situation, how would you interact with them? What's the healthiest way for us to interact with them? Using a situation that they may find themselves in right now. And I think you mentioned some people are focused on like thinking about the future and like going to heaven when they die. Did I hear that? No?
Yeah.
Yes. Okay. Like, wait, did I make that up? So again, if they are a religious person and if you feel comfortable, right, then you can talk about okay, what does the Bible say that you should be doing right now? How does the Bible tell you to live right now? so that you do make it to heaven? What are the things that you should be doing right now? What does God tell you to do? What is God telling you today? When you prayed this morning, what did God tell you to do? So there's always a way to validate it and then bring them back. So that's part of our jobs as the clinician, is to redirect, if that's what's best for your client, right? I chose humanistic because I like humanistic and I think that it works. But if you don't connect with that, then you have to find a way to use your theory in a way that works for you and the client. So I may like humanistic, but if my client needs psychodynamic, right, then I have to adjust and do what's best for the client. So humanistic was, again, just an example. And like, yeah, it typically works, but if that's not what your client needs in that moment, you definitely want to adjust. Did that answer your question?
Oh yeah, wonderfully. It remind me, I forgot. I remember like what Dr. Yahayana said to one of our theory classes, that if there's something that is in the future or in the present that you can, in the future or in the past that you can use to help deal with the present, there's no wrong to go jump over and then grab it and bring it back to the present.
Mm-hmm.
So you did well. Thank you.
Thank you. Y'all have great questions.
Any other questions? I had a question, just like about like the nurturing Black minds, the one that you founded. Just like, I'm just very curious about that, and I feel like it is something really very important. I'm just curious about like if you have any funding for that one, like how did you come up with that idea, how it is working, like just a little bit about that, because I think it's something very unique, and we need that kind of things, to have more intentional resources for diverse background populations.
Yeah. So I worked in higher ed while I was working on my PhD. And what I saw was that a lot of our Black students just weren't prepared, not even academically, but mentally for a lot of students in general. I worked at HBCUs mostly, so I dealt mostly with Black students. They weren't mentally prepared and emotionally prepared for that transition. So one of my programs is Dream in Color. I created a workbook with different activities based on like value assessments and self-efficacy, building self-efficacy and things like that based on Bandura social learning theory, right? Those activities to build those things, because that's what research says will help them to be more successful. So that's what that program is about. It's about the college transition, like the transition to college, but the mental transition, the emotional transition. And then the other part of Nurturing Black Minds is connecting community members to clinicians of color, because we know that historically, Black people have not had access to quality care due to stigma, due to lack of awareness, due to all of these different systemic barriers. And so we kind of like eliminated those, and it's like, hey, come to us, we'll help you. Not only will we link you to a Black therapist, but for those of you who may not have insurance, do not have a EAP program, can't go to your school counselor, we have a scholarship that funds 5 sessions for community members to go see Black therapists.
That's really nice. We had something very similar at Texas A&M University for Hispanic population. So I really appreciated that. It was really very impactful for the first generation Hispanic population who are like going to college with their experience. So yeah, I really appreciate that.
Yeah, thank you. I appreciate you for having me. This was amazing.
Oh my God, this is really very helpful for us, with your research, with your clinical experiences. So I'm sure, it has contributed a lot to our multicultural journey of becoming multiculturally competent counselors. So I really appreciate you being here, sharing your very good experiences with us.
Thank you, of course. Thank you.
Yeah, thank you so much, Dr. Lomax. And yeah, I don't know, any resources, if the students need the slide. If you would be interested in sharing the slide with us, that would be really nice. Because I think like specifically the things from your dissertation, I really like that. Yeah.
Okay. Yeah,
Yeah.
I will share that with you.
Okay. Thank you so much.
All right. Good night.
Bye bye.
Thank you.